Okay, so we're doing the newborn assessment. The first thing we would do is the APGAR score, which will be done at 1 minute and again at 5 minutes of life. And basically, we're looking to gauge the baby and how well they're doing. We'd score the five different areas anywhere from 0 to 2. The normal expectation would be anywhere from a score of 8 to 10. Anything below 8 would possibly be cause for different types of interventions. So we're hoping for 8 to 10. The first is appearance, and baby is nicely colored. Um, is her color and undertones are consistent with ethnic background, so she scores a 2. Okay. At this point, we'd listen to the pulse. Okay, and we'd be looking for a pulse range above 100, and it is, which again scores for a 2. We'd use the apical pulse site for that. The baby is grimacing. She's responding immediately to any type of stimulus. So again, she receives a score of 2 in that area. And the baby is active, crying, moving all the arms and legs. So she receives a 2 again. And her cry is quite loud, which also receives a score of 2. So this baby scored a perfect 10. So that's great. Next, we're going to assess the vital sounds, and we're going to assess the heart rate and the sounds. So heart rate at the apical pulse, it's above 100. Again, we're hoping for a score anywhere from 110 to 160. If there was a slight murmur present, this could also be normal as well. We would just keep an eye on it over the next few weeks or depending. We check the pulses, so the brachial pulse as well as the femoral pulse, and they're both strong and regular and equal. So perfect finding. Respirations at this point, we'd count for a full minute, and we're hoping that they're easy and unlabored. We're looking for any type of signs of respiratory distress, which there are none. There's no nasal flaring on breaths. We're hoping for 30 to 60 breaths in that 1 minute. There can be a period of apnea, and as long as it doesn't exceed about 20 to 30 seconds, that's a normal finding. Okay. We're going to take in axillary temperature, which we're hoping for a score of about 36.5 to 37.5 degrees Celsius, and we're taking it at the axilla. All right. And we're going to, at this point, measure the baby. So we're going from tip to tip, and the body length should fall in between 48 to 52 centimeters. We would weigh the baby, and we're hoping for a weight in between 2,500 and 4,000 grams. We take the birth weight and multiply it by 0.9 to figure out a figure which should be within 10% of what the baby was born at, the original birth weight. So it's an expectation that they lose some weight after birth, as long as it doesn't go above 10% of the original birth weight, then perfectly within normal limits. We're going to take a head circumference measurement. Okay, and we're hoping for a circumference of about 32 to 37 centimeters. The head size is about 1/4 the length of the body size, and we're also going to take a chest circumference, which we're hoping for about 30 to 35 centimeters. Okay, and perfect. Baby is well within normal limits. There may be some labs ordered, possibly hemoglobin, which we'd be looking for about 14 to 20. Hematocrit could be ordered, which would be anywhere from about 43 to 63%. There might be blood glucose ordered, which would be anywhere from about 40 to 80 milligrams per deciliter. And there might be a white blood cell count ordered, which we'd be hoping for about 10,000 to 30,000 count on that. We're going to now inspect and assess the head. What we're looking for are two fontanelles, one at the anterior, another one located at the posterior region. The posterior fontanelle is more of a triangular shape, whereas the anterior is diamond shape. And we're looking for is their presence, and uh, we're hoping that they're flat, which they are. If they were bulging, kind of, then you would suspect maybe intracranial pressure, increased intracranial pressure. And if they were depressed, you might, you know, inspect for signs and symptoms of dehydration. But those findings would be indicative of, further exploration. At this point, we're going to palpate for the sutures, which we're looking for the sagittal suture, which is along the midline, and we're looking for the squamous sutures. And what we're hoping for is that the sutures are either overlapping or flat. We're just trying to make sure that they aren't pretty much too far spread apart, which might indicate some further inspection necessary. So they are present. We're looking for the presence of molding. Molding is a completely normal finding. It would occur during the birthing process as the baby's head exits the vaginal canal. So we would just keep an eye on that. We would look also for Kappa cecidianum or cephalohematoma, and there's no signs and symptoms of that here. So perfectly normal findings. At this point, we'd look at the eyes and we'd check on the perla. Okay. And we're looking for, any type of strabismus or maybe even a pseudostrabismus, which everything is equal, round, reactive to light, so well within normal limits. There are no presence of epicanthal folds. It can be present depending on the ethnic background of the baby, but here there are none. The sclera are nice and white, so there's no indication for further examination there. At this point, we'd look at the ears and make sure the top of the ears are in alignment with the outer canthus of the eye. Okay, the ears are formed normally, nicely shaped, and there are no presence of skin tags, either preauricular skin tags or any type of dimpling, which might be indicative of further investigation necessary. We'd look at the nose and check for patency. All right, so in order to do that, we'd have the gloved hand and the baby would suck on the finger. We would close off one of the nostrils and the other nostril, and we'd be looking to make sure that the baby is still able to have adequate respirations, and that would give us the indication of nasal patency. We're also making sure that there's no flaring on breathing, which could be indicative of respiratory distress, which there is no signs and symptoms of that here. At the mouth, we're going to palpate the hard and the soft palate, and they're intact. We're assessing for natal teeth, which there are none, which could give complications when it comes to feeding, which we might look into further. There's no signs of Epstein pearls, little white spots on the gums. They could also be present on the hard palate. We'd look for the presence of circumoral cyanosis, which it's negative here. So there's no bluing around the mouth region, anything like that. And the tongue is completely freely moving. So no complications there. At this point, we'd assess and inspect the neck, the trachea. The trachea is midline, okay, and it's nice and present. There's no palpable masses. The neck is completely absent of any type of webbing, which might be indicative of a genetic anomaly, but there's no presence of that here. And we'd also check the clavicles, which could be damaged or fractured through the birthing process. So we're making sure that there's no signs of fracture. Okay. And we'd also inspect the chest, make sure that it's circular appearance, symmetrical. The presence of discharge, there is none. If there were, then it would be a normal finding that is referred to as witch's milk, which is just indicative of a hormonal change from the prenatal period to the after birth period. We check the hands, make sure that there's 5 fingers on each hand. We'd look at the palms to make sure that there wasn't a single palmar crease. There are multiple palmar creases on this child. If there were a single, then it might be something we'd look into further. The skin, the texture of the skin is smooth, supple. It's consistent with ethnic background. If it were sticky or possibly even dry or peeling, this might be indicative of premature or post-mature gestational age, which it's not in this case. We'd again look at the face for any forceps marks, which could be a normal finding depending on what the birthing process entailed. There are no forceps marks here, so good finding. We're also going to look for vascular birthmarks. If they're present, we would need to, assess them further, whether or not they were, port stain marks or strawberry, even the cafe au lait birthmarks. We would assess the location of them, the number of them, whether or not they were blanched, whether they were flat or raised. These would all be indicators of whether or not it'd be a normal birthmark or not. But there are no birthmarks present, so that's a good finding. There's no vernix, there's no lanugo. These are more consistent with preterm babies. This baby was full term, so there's no presence of lanugo, no presence of vernix. There are some signs of milia on the nose, but this is fine, as it'll go away within a couple weeks. We'll just keep an eye on it. There is no petechiae, no ecchymiosis, no bruising, no birthmarks, and no arrhythmia toxicum. All of these would most likely resolve on their own, but because there is no presence of them, we'll just move on. No Mongolian spots anywhere based on the ethnic background. This might be a consistent finding, but there are none. Okay. At this point, we'd look at the umbilical cord, and we'd make sure that there's 3 vessels. There'd be 2 arteries and 1 vein present, and that's a perfect finding. The shape is symmetrical of the abdomen. There's no deformities. Okay. Would do a listen. Okay. And presence of bowel sounds, perfectly normal finding. All right. We look at the genitals at this point, and basically the labia majora, we would want to be covering the labia minora, which is a perfectly normal gestational finding with a full-term baby. If this were a male, we'd be examining the testes to make sure that there were 2 testes, both were descended, that the meatus of the penis was midline and at the top of the penis, and not posterior or anterior to the tip, and that the scrotum had rugae, which could be edematous at that moment, which completely normal. At this stage, we check the spine, okay, and we'd make sure that it feels straight and intact. All right, so we just rub our hand along the spine, all right, and perfect. The baby has sporadic movements. We know that the nerves are intact, so as you touch it, you should see some slight movements. So it tells you that the spinal nerves, the range of motion is equal. So those are good findings. We check the extremities, make sure that they were equal in length. Compare the 2. So legs, same length, feet, hands, arms. There are some symmetrical skin folds on the back of the thighs, and they're equal, so that's a perfect finding. Baby appears to have full range of motion as it's moving all around, um, symmetrical, and there are some wrinkles on the feet, which are a normal expectation as well. Um, we could do at this stage a Barlow or Ortolani test, where we place our finger at the greater trochanter and lead outward and back inward. And as long as there are no presence of clicks, then that's a normal finding. Okay. At this stage, we look for any signs and symptoms of adequate hepatic system, and we're looking for jaundice. Jaundice would follow more of a head to toe progression. There's no signs and symptoms of jaundice on this baby, but as long as, if there were, as long as it didn't really go past the nipple line, we wouldn't really be too concerned. We'd keep an eye on it and look for that to resolve within a few days or so. Looking for bleeding or bruising. Again, the baby just underwent the birthing process, so make sure that there's no signs of bruising, no bleeding. If it were, we would need to take note of it. And we could also assess the blood glucose we did earlier. Again, the normal finding is within 40 to 80. We'd do a renal assessment, which we'd monitor the I's and O's on the baby. We'd assess the characteristics of the urine, color, odor. If the urine was a little discolored, say maybe a brick dust type color, this would be a normal finding, especially if the baby is breastfeeding. It will resolve as the mother's milk increases, but yeah, we keep an eye on the I's and O's to make sure that the baby does in fact have adequate renal functioning. We check the immunities, any signs and symptoms of infection. We check the white blood cell count, make sure that it's within that 10 to 30,000 range. The temperature can go either way for an infection. So again, this baby had a nice normal temperature of in between 97.5 and 99 degrees Fahrenheit, 36.5 and 37.5 degrees Celsius. So there's no need for any further assessment there. And we check the metabolic and GI system. So we'd look for anal patency. If the baby had already had a bowel movement, it would be the expectation that it'd be a meconium movement, which would be like the first couple bowel movements, and that would indicate anal patency, or we'd inspect for patency, make sure that there's an opening. The neurological system, baby is alert. The extremities are flexed. The baby is crying. The muscle tone is adequate. Baby's not just flaccid. So that's a great neurological indicator that the system is in perfect functioning. Assist for jitteriness, maybe any kind of tremors, or signs of a seizure. So all of these would be a neurological assessment that would pretty much be going on throughout. At this stage, you might check the reflexes, and the reflexes you would check for the rooting reflex, which you would just rub your hand on the side of the cheek, and the baby would turn towards to look to suck, and you do that on both sides. And the baby would turn his head towards. You could check the sucking reflex, and you put the gloved finger in the mouth. They should suck on it. After that, they should actually swallow spontaneously. You would look for the palmar reflex. You would place your fingers in the baby's hand, and they should grab your hand. Same with the plantar reflex. So the baby's toes should kind of curl up to try to grasp your hands. You could do a Moro reflex, which holding the baby, you would kind of let it go a little bit and basically hope that it startles the baby. The baby's arms should kind of flail out The leg should kind of flail out. This is a good reflex indicator, and it's perfectly normal. It's what we expect. We would do the tonic neck or flexor reflex, where basically whichever way the baby's head is turned, the arm would come out straight, and this adjacent arm would kind of flex. And the same thing if the baby's head would turn this way, arm would come out straight, and this arm would be flexed. So we would do a Babinski test, where we'd go along the plantar surface of the foot, and the baby's toes should open up and flail out a little bit, and you'd want to see that on both toes, both feet. And then we do a crawling reflex test, and basically if the baby was put on the stomach, it should try to make like a crawling motion. At this stage, we might do a new Ballard scale, which again tells us the gestational age based on appropriate findings, and it's scored on a -1 to about a 5, and the higher the score, basically the higher the maturity of the child. A normal range would be around anywhere from about a score of 33 to about 40, which would be indicative of a full-term gestational age, not post-term or preterm. So you would look at the posture. As long as the baby was fully flexed, it would get a score of about a 4. You'd look at the square window, so the wrist, and if it was able to give you about a 30-degree angle, this would be about a 3. A 0-degree angle would be a 4, but that's fine to get it. As long as you get about a 45, maybe a 30-degree angle, should be pretty good. This baby had a 30-degree angle. The arm recoil, so arm recoils at a 90 to about 110 degrees, so that's about a 3. Popliteal angle, about 100 degrees. It's about a 3 as well. Scarf sign, which we would just basically, the arm would go across the chest. That angle of that, or the ability